The determinants are many. And we can see here that we have to build these determinants of active aging with a background of gender and culture. Men and women age differently, not only because we have different hormones, but because the social construct of what is to be a man and a woman in different societies will be very different. You have the privilege of providing care. You are women, the main carers. We miss out. On the other hand, it is important to bring us into this equation, to change the paradigm of what is to be a male in very chauvinistic and male-oriented societies like Brazil is and also is Australia, so that we can build together a more caring world, especially because societies are aging so fast. And of course, the culture, what works in Shanghai or in Bolivia, may not work well in Brisbane, but it is important to think about. I'm not doing well with this. Okay, there we are. And the active aging is right in the middle. This is what we want. And in order to get there, we need the contribution of these groups of determinants. Access to services, behavior, personal determinants, the physical environment, the social environment, the economic determinants, all of them contributing individually to active aging, but also all interrelated. So it's complex. And that is what the Age-Friendly Cities movement is trying to do, is to operationalize the idea of active aging into practice, putting this framework into practice in the context of a city. And for that, we also need a life course perspective. We have to bring to these children the message that the best that can happen to them is to age. After all, there is only one alternative. What you would prefer? Premature death? So let us age positively, facing what is really the greatest achievement of the 20th century, more than 30 years of extra life given to us, and yet so many people talk about age in a negative way, like a burden, like a problem, like a punishment. And this life course perspective is important because it is also a new framework. It is an approach that offers this interdisciplinary framework that can guide us to research, to policies, and can help us to disentangle and to understand the human development and aging. And it is encapsulated into this graph. When we are born, we are completely dependent on our parents, and let us follow this red line, which is what we want. Very quickly, in the stages of growth and development in childhood and adolescence, we reach the peak of our functional capacity. I'm not talking about intellectual capacity, but physical, our strength, our speed, our ventilatory, cardiovascular capacity. And then gradually, once we reach that peak, we start to decline. What I'm saying is that it costs them double, 3 times, 4 times the effort that takes for us to come here and to participate in society. We have to appreciate this gift of life for those that can reach old age above the disability threshold. But we should not put barriers, because now I'm afraid I'm going to look at you and I'm going to tell you, for you to come here to this podium, in this modern building, in this theater, you would have to be cared in order to come and overcome this barrier that is unnecessary. It is inhuman to put you in a situation that you would have to be humiliated, to be cared, to be put here to do what I am doing because I am able to manipulate the steps, but you are not. What society are we building that we still allow the barriers like this, even in a modern building like this library is? And that is the disability threshold that we can put high, like we have here, or much lower. And if we put it lower, eliminating this step, everybody that could otherwise not manipulate because the threshold was too high, all this group of people would be free from disabilities, not because they don't have the disability organically, functionally, but because we have improved the environment. And sometimes all that is needed is put a ramp instead of a step, as it would be so easy to put here in this auditorium. And the other problem, of course, is that for many people in the yellow line, it would be the problem of not reaching the functional capacity peak because of poverty, because of subnutrition, because of infections that could have been prevented were not, preventing all this group of people to reach the maximum of their functional capacity early in life. And I'm talking about the Aborigines in Australia. All these disadvantages throughout the first stages of life that will make your health capital so much poorer than it is for the vast majority of us here. And then throughout the stages of adult life, the social determinants of health. It's the poverty, the quality of their work, the impediments that will make more difficult for you to work, the stress, and you work 10 hours and then you have an hour and a half of very bad public transport, which is the reality for the vast majority of the world. Not you, but it is the reality for the vast majority of the world that cannot age well because of the conditions in which they work, in which they get entertainment if they are able to, the conditions in which they can or not socialize. And then you hit the disability threshold early in life, say at the age of 60, you have a stroke, and you may be alive for another 30 years, but with a quality of life that doesn't compare with the other one that continues to age above the disability threshold and may die without having ever experienced becoming disabled before that death. So this life course perspective is of paramount importance as we grow older and can offer to our populations this experience of aging well. So it is time for a new paradigm. One in which we can see older people as protagonists, beneficiaries as well as contributors to society, to the economy, to the well-being. And for that we need to make the effort of ensuring that their voices will be heard. Come on. And for that, what the Age-Friendly Cities does is to organize focus groups with older people. Ask older people. They know best than the experts, so-called. Ask them, what is to live in Brisbane? What are the impediments? What are the pros and cons? What are the difficulties? What kind of policies are necessary so that the quality of life can improve for everybody, including themselves? So it is a bottom-up approach. It's listening to the voice, and increasingly what we are doing throughout the world, not only listening to these voices, but once we listen to them, we can organize public forum like here, like we have done in Adelaide with younger people, people of all generations, working together with this common aim of making Adelaide, Brisbane, New York, Geneva more age-friendly. But we also need a top-down approach. It's not enough to listen to the voices if we're not going to do anything with them. We also need to involve the government, the councillors, these people that you elected yesterday. Let us give another week. Today is a bit too early. There is still probably celebrating with too much bubbles and good shiraz. But tomorrow or next week, let us listen. Let us bring them to the debate, because we'll need this top-down approach as we are doing. These are two toolkits and guidelines that were produced by the South Australian government, translating that Vancouver Protocol into the reality of South Australia. And we are bringing here all these dimensions that will make our lives better. It works for everybody, all ages, but it is particularly important as we age. We are talking about policies in transportation, housing, social participation, respect and social inclusion, civic participation, and employment. Yes, employment. Many older people need to continue to work. It's not only because they want and society should allow them, but also because many people in the world still depend on their work in order to have an income. Communication and information, community support and health services, outdoor spaces, this is space, public building. So it's the combination of all these different dimensions that will enrich or impoverish our lives. And the protocol, the Vancouver Protocol, in which to base the focus groups for all the people are based on these dimensions. And then once we did this research in 2006, 2007, we could, on the 1st of October, the International Day of Older Persons, launch worldwide the WHO Global Age-Friendly Cities, a guide. And inside this guide you have these 4 pages like this. Sorry, this is in Spanish, but it is translated in all important UN languages. A checklist. All these 8 dimensions translated into a tool that can help the policymaker to start to look at what is going on here in Brisbane. What is the starting point? And then we have to listen to the voices of people that are aging in Brisbane, so that we can go straight into what really matters in this society. As I said, since 2007, since launching the guide, hundreds of cities throughout the world have joined this network. Cities like in Brazil, where we have now a public transport with this different logo. And you see the difference. Instead of an older person that is bent with a walking stick, not that there is anything wrong with needing a walking stick, but the vast majority of older people don't have a walking stick. Why do we have to symbolize universally older age with the walking stick? It is already going to the negative rather than to the positive. The vast majority of older people, I can guarantee that you know, over the age of 60, don't have it. It's a bit like the vast majority of women don't have mustache, and it would be like having a mustache to identify women. It doesn't hold. So we have to think in terms of what is common, and then find a logo universally that we can really identify all the people in a positive way.